Hello, and thank you for joining me. Today, I will be discussing post-stroke fatigue and its significant impact on rehabilitation, particularly in the context of inpatient therapy. I will address how post-stroke fatigue affects communication, mobility, and therapy engagement, three critical aspects of post-stroke recovery. So here is just a brief overview of today's agenda for the presentation. As an extern in the rehab wing, I've encountered a recurring issue. Post-stroke patients often come to our rehab exhausted, whether it's physically, emotionally, or cognitively. Many of these individuals who have survived a stroke are expected to participate in intensive therapy, sometimes involving 3 hours of therapy per day. Well, here's the issue. Despite patients' desires to get better, many are simply too fatigued to engage in such demanding therapy schedules. This disconnect between patient readiness and therapy demands creates a dilemma for healthcare providers. From a therapist perspective, we face a difficult decision. Is pushing patients to meet these productivity standards beneficial for recovery, or is it potentially harmful, leading to frustration, disengagement, and slower progress? Because of this, patients often feel frustrated, and therapists are torn between ethical obligation to care for the patient and the demands of productivity. For me, this experience raised important questions. How can we balance patient-centered care with the needs for high productivity? And how can we support patients dealing with fatigue while still ensuring that they receive the necessary therapy? To explore these questions, I consulted a variety of resources to gather evidence and understand this issue more deeply. So here's a look at some of the key references that I consulted. So as I stated before, one of the critical factors influencing the effectiveness of post-stroke rehab is the pressure on clinicians to meet productivity standards, which is highlighted in this study by Bennett et al. As healthcare costs rise, rehab professionals are facing increasing demands to treat more patients, see more billable hours, and keep up with administrative tasks, often at the expense of quality of care. This study revealed that productivity pressures lead to clinician burnout, stress, and unethical practices such as focusing more on quantity rather than quality of care. For post-stroke patients, particularly those with fatigue, this can be detrimental. Fatigue often affects cognitive and physical function, and when clinicians are overburdened with productivity targets, they may not have the time or energy to provide the individualized care that these patients are needing. Ultimately, the findings from this study emphasize that while productivity is important, it should not come at the cost of ethical, patient-centered care. For stroke survivors experiencing fatigue, the focus needs to remain on providing quality, personalized rehab, not just meeting numerical targets. This article called for a shift in how productivity is measured, ensuring that rehab professionals can give the best possible care to patients without compromising their well-being or clinical ethics. The next article I reviewed by Choi Kwon and Kim, 2011, aimed to define post-stroke fatigue and describe some of the factors that contribute to a patient developing this condition. The article highlighted that POSF is influenced by a range of factors, including demographics, physiological issues, psychological conditions like depression, and even biological factors like brain lesions and neurotransmitter imbalances. POSF has significant impacts on recovery. Fatigue can severely limit a patient's ability to engage in rehab and affect their independence and quality of life. The article stressed the importance of a multidisciplinary approach to treatment, combining therapies that address both the physical and psychological aspects of fatigue. Implications for therapy from this article included a need for comprehensive assessment to identify and manage potential causes of POSF, such as sleep disorders, depression, and other comorbid conditions. A multidisciplinary approach involving medical management, rehab therapy, and psychological support is critical for treating fatigue. Addressing factors like sleep, nutrition, and stress management can play key roles in improving these patient outcomes. The article also emphasized the importance of pharmaceutical treatments, though further research is necessary to determine the most effective drugs for managing POSF. Finally, psychosocial support is essential to help improve mental well-being and coping strategies for these patients. This can help reduce their overall impact of the fatigue on their lives. This study by Christensen et al. 2016 aimed to understand the healthcare needs of stroke survivors, both within the hospital and 1 year post-rehab. The researchers wanted to explore how patient involvement in decision-making about their treatment, along with their perceived impact of their stroke, influenced the extent to which they felt that their healthcare needs were met. The findings revealed a number of unmet needs among stroke survivors. especially in areas like mobility, pain, fatigue, and emotional health. Interestingly, survivors who were more involved in decisions about their care were more likely to feel that their needs were met and showed better satisfaction with their rehab. However, the study also found a gap between the rehab services provided and the long-term needs of stroke survivors, especially regarding social participation and emotional well-being. These aspects were often neglected despite being crucial for a full recovery. The key takeaway here is that stroke rehab needs to go beyond physical recovery and address the psychosocial and emotional challenges faced by survivors to improve their overall quality of life. This study by Wu et al. 2015 reviewed various interventions for post-stroke fatigue, highlighting that while some treatments like pharmaceutical and psychological approaches showed potential, the evidence is still inconclusive due to small and diverse trials. The key takeaway for an acute rehab setting from this article is that managing post-stroke fatigue requires a multifaceted approach, but there's no one-size-fits-all solution. While certain interventions like cognitive behavioral therapy and physical activity might hold promise, more research is needed to identify effective strategies. In the meantime, in a rehab, we can focus on individualized care, considering a mix of pharmaceutical, psychological, and physical strategies, all while closely monitoring patient responses and adjusting their care plans as needed. Based on my research, post-stroke fatigue is a major obstacle in stroke rehabilitation. It significantly impacts a patient's ability to participate in therapy, communicate, and recover effectively. Studies highlight its prevalence and the negative effects it has on physical and cognitive function, which ultimately slow down recovery. Therapist productivity pressures, as noted in some of the research, may worsen this situation, as therapists sometimes push their patients too hard, risking burnout or falls. A more effective approach involves patient-centered care, where empowering patients to be involved in their treatment decisions can boost their engagement and improve their outcomes. Additionally, various interventions, including activity pacing, rest intervals, and cognitive behavioral strategies, have proven to be effective in managing fatigue. By addressing these factors, reducing fatigue, enhancing patient involvement, and balancing therapist workloads, rehab can be a more personalized and successful process for stroke survivors. So with all this information, how can we better manage post-stroke fatigue in an inpatient rehab? First, patient-centered scheduling is key. Therapy sessions should be broken into shorter, more frequent blocks with built-in rest periods. This will allow patients to recover without losing vital therapy time. Next, multidisciplinary collaboration is essential. Speech, PT, and OT should coordinate care to adjust intensity and incorporate cognitive breaks based on each patient's fatigue levels. Education plays a big role too. By teaching both patients and caregivers effective fatigue management strategies like pacing and resting, we can empower patients to take an active role in their recovery. Finally, we need to reevaluate productivity demands in the rehab setting. By adjusting expectations and allowing for more flexibility in schedules, we can reduce stress for both patients and clinicians, ensuring better care and outcomes. Now, as we wrap up, there are still some key questions that need further exploration. First, how can we improve the measurement of fatigue in a rehab setting? Having reliable, consistent tools to gauge fatigue levels would be incredibly helpful for tailoring therapy to each patient's need and ensuring that they receive the right level of care. Another important question is, what are the most effective long-term interventions for managing post-stroke fatigue? Finding strategies that work over the long run without overwhelming either party of clinician or patient could significantly improve recovery outcomes and overall quality of life. These are just some areas that deserve continued attention and research. In conclusion, managing post-stroke fatigue is essential to improving therapy engagement and outcomes. By adjusting therapy schedules, promoting multidisciplinary collaboration, and fostering patient-centered care, we can help patients recover more effectively while still managing their fatigue. Thank you for joining me today.